All right, guys. Welcome to our third guest lecture in our West Africa guest lecture series. Today is our third and last presentation. This is journalist Emmanuel Akinwotu, and he is reporting for The Guardian in Lagos, Nigeria. Um, and so, Emmanuel, we have already heard last week and this week from a journalist with My Joy News in Ghana and a journalist with Patrick Fort with Agence France Presse in Ivory Coast. And without further ado, I will let Emmanuel take it away. And we are recording.
Thank you, Jeslyn, and it's a pleasure to meet you all. And maybe you can just give a thumbs up if you can hear me clearly, because I'm not really sure. And also, I'm sorry because there's a bar on my street. You can probably hear the music, so I'm sorry about that. Yeah, it really kicks off after 9. So it's about 10 p.m. In Lagos right now. And yeah, as I said, it's a pleasure to talk to you all about journalism and coronavirus coverage that I've been doing over the last almost a year with The Guardian. I'm the Guardian's West Africa correspondent based in Lagos, and I started in April. So maybe I'll just start by speaking a little bit about myself and background, and I'll just dive into the reporting I've been doing and share some observations. So I have a British accent, so I was born and grew up in London. My parents are Nigerian, and it wasn't their plan for me to ever live in Nigeria. But I wanted to do international journalism, and I thought that Nigeria would be a great place to start. So when I left uni, I came to Nigeria, started freelancing, and I was kind of going back and forth. And then I was working for freelancing for The Guardian and the New York Times, and then got a job with AFP covering Nigeria, Ghana, Benin, and Togo. And then last April, started with The Guardian full time. And when I started, it was weird because I started in London, and I mean, I was in Nigeria with AFP, got the job with The Guardian, went to London to see family. Then, even though the kind of it was early in I think there'd been like 1 or 2 cases in Lagos, which I had reported with AFP, and even then, we were kind of like, first cases in Nigeria, and sort of, kind of, the tenor of our reporting was really like worry about where this was going to go for Nigeria, for Africa, seeing how it had already started to unravel in Europe and the West, and Asia. But even then, we were kind of in the early ignorant phase of the pandemic, where we were kind of looking at the news, seeing, all these kind of like worrying developments, but still kind of being like, but in August I've still got like plans to go here, there, and wherever, and I still plan on going holiday in July. Do you know what I mean? Like it was odd. So I went to London and ended up being stuck there rather, because Nigeria closed all its international borders, as did many African countries, which was like a huge step in actually in preventing cases from spreading, and really kind of gave them a head start. And so I've started with The Guardian covering West Africa from Croydon in South London, from my living room, and it was a challenge in different ways, but kind of managed that, and then I moved back to Lagos in July on a humanitarian flight by the Nigerian government, which was something I never thought I'd ever need. I always thought I'd be rescued by the British government for something happening in Nigeria, but such is the pandemic. And then went back to Lagos and then started covering it on the ground. And so in a way, I was kind of covering it from afar in a method of journalism I didn't like, but also, kind of allowed me to see some things in a different way. And then when I was able to go to Nigeria and see things on the ground, it meant that I already had some kind of understanding and I was able to build on that. So that in some of the things that I will be referring to, that kind of informs the kind of journey of coverage I did from last April up until now. So I guess I'll start by talking about the kind of coverage we did, that I've done, which I've kind of grouped into different subcategories. Firstly, on the impact of COVID. So I remember the first story I did with The Guardian was a story on volunteers in Lagos, a kind of like, it felt like an army of volunteers across the city, kind of helping with the effects of the lockdown in Lagos, which were dramatic. So early stage of the pandemic obviously was that countries were locking down in West Africa quite quickly. And obviously lockdowns had been adopted from from China and South Asian countries, and Western countries were locking down quite harshly. And obviously wherever this was happening, the economic effects were quite dramatic. In Nigeria and in West Africa, where many of the economies rely on heavy informal sectors where people earn daily wages, the effects were even more dramatic. And so there was early on already very vigorous discussion about what kind of measures African countries were going to adopt in order to curb the pandemic from spreading, but also not lead to economic dismay, really. But governments broadly lined along measures that was preventing the pandemic, and then they thought about the economic effects after. Some countries responded in different ways to the economic effects, but Nigeria, I'd say, was definitely one of the countries that responded most poorly. And so quite quickly, you saw the economic effects were really devastating to people on the ground. So I wanted to kind of document that in a way that felt less bleak, being in my kind of dim living room in South London, seeing all of this stuff online. And so I covered volunteer groups of all sorts of different forms forming across Lagos, and that were doing a lot to kind of step in the absence of tangible government support on the ground. And really talking to these groups on Skype, on Zoom, what was fascinating to me. There was one group in particular that I was really drawn to, which was this couple, where one of them had started a yoga class in Lagos for a few years, and the other was, I can't remember, I think she worked for an NGO, and they lived in a part of Lagos where they'd seen a lot of suffering, so they had already started gathering volunteers amongst their friends, and they sort of started this kind of like really organic way of just helping people that they knew. But it obviously, which is unsurprising to me, you start giving help to a few people and you realize how many more people are in need. And so the thing that they started grew and grew to the point where they now had this like very detailed database of people who lived in their area and the exact needs they had. And so they'd already had that database pre-COVID. And then when COVID happened and things got so much worse, so much visibly worse, they were able to they already had the infrastructure, essentially. Their friends who were really kind of thinking, what can I do to help, were able to kind of buy into that and build on that. And so I was really drawn to that because that wasn't just a kind of typical scenario, do you know what I mean? A typical form of people giving help. So I did coverage on that, essentially on volunteers stepping up in Lagos, which I think is the headline, was we need to do more.
You want me to show
so
that story, Emmanuel?
Yeah, yes, please. So that's the first link I sent you.
Sure. Let me display that.
Yeah.
It's a cool story. All right, here we go.
But yeah, so it will come up on your screens, I guess, in a few moments.
Can you see it, Emmanuel?
I can't, but if you all can, that's fine.
Ella, can you see it?
Yeah, I can see it.
All right.
Yeah. Okay.
Tell us what we're looking at here. Tell us the story.
Okay. Yeah, sure. So Well, I'm looking at it on another screen. So obviously it starts again, yeah, with 12 friends. So this was an interesting way of doing a story as well, because I was in London at the time. And so the photographer that I had, that I was working with, called Grace, who's a brilliant photographer, Grace Ekpu, I'd already had conversations with them. They told me things I'd done reporting via conversations with these different people, but I wasn't able to see things on the ground. I was just relying on their word and on some Instagram posts and social media. And so really like I did a lot of the verifying through Grace, going with them. So when I knew it was those people who I wanted to lead the article with, in particular, I got Grace to take photos of them, and she did a lot of describing to me of what she saw and just kind of confirming the things that I had heard in conversation with them. So that was something that I never used a photographer to do reporting before. And that was cool. And so we did that. And in other types of groups too, there were actual NGOs, there was like celebrities and such. And that was like a kind of big thing going on in Lagos. But I guess the other side of this story, which the story didn't really have the space to touch on, was just the level of anger at the government that we were already seeing. That, you know, there was all this like kind of economic despair, and the government was really just not there, really. And that anger materialized in different ways. The next link that I sent was another example of story I did early on, was an interview with a photographer. So that was this photographer called Nuruddin Olubade, who I found really fascinating when I connected with him online. He was working as a kind of delivery vendor, delivering kind of like takeaway food, living in quite a poor part of Lagos. And kind of wanted to do photography, sort of had a mentor, but didn't really have money for a camera. He was sort of using his phone and editing on his phone as well. And he lived in a part of Lagos that he kind of viewed as being very kind of neglected. At that stage of the pandemic, telling people to wear masks was funny there. He was describing, because, you know, they live in conditions where there seems like there are a lot of other things that can kill you, and felt more likely to kill you than COVID did. And so he took pictures that sort of tried to speak to how people felt in his area. And I felt like it was cool to kind of speak to him and to document that, just because it felt even more organic. You know, this was someone who was taking pictures on his phone, editing it on his phone, and who wasn't able to work because of the pandemic. And so this project he did kind of came out of being idle. And it felt cool to kind of give that a platform.
Emmanuel, I'm showing them the photos you took.
And so, yeah,
right
those
now.
are some of the things I did.
I'm showing them I'm
right.
scrolling through the photos from your article right now in the
Okay,
Nigerian photographer.
Awesome. So then maybe some other, so yeah, I did so just to kind of cap off that bit, is I was doing stories on the kind of the impact of the pandemic in Lagos, in Nigeria, and how it was kind of transpiring. Then I did articles also on the kind of secondary impacts of the pandemic. So one of the big things was a food crisis in West Africa, you know, kind of brought by the fact that COVID was like hitting a lot of markets. So supply chains were really hit because markets were shut down or restricted. Also compounding other factors that are kind of already at play in West Africa: climate change, insecurity spreading in the Sahel, in northeast Nigeria. And so the UN were really quite sounding the alarm about a food crisis in West Africa. So that's the kind of secondary impact of COVID, right? In which countries are dealing with the pandemic, but that's having loads of different knock-on effects. And another aspect of that was also impact on polio vaccination campaigns. So maybe Jeslyn, if you could go in the email I sent, there was so this will be the 7th link.
Okay.
You know, polio has been a big problem in Africa. as it has been in different parts of the world, but in Africa, it's a problem that has lasted much longer than people would have liked to see, and the vaccination campaigns, which really had evolved into really a kind of remarkable infrastructure, was suffering because countries were having to redeploy all efforts to fight COVID, and therefore other diseases, disease eradication was suffering in terms of dealing with other diseases. So that was a kind of something that I felt was important, was that countries were doing a lot to fight COVID, but we could start to see progress on things like polio eradication suffer. And then there was another kind of secondary impact, is like something I was really interested in as well, was like the impact on places of worship. And so when I moved to Nigeria, when I got back to Nigeria, one of the first pieces I did was do a kind of piece on a church, the main Catholic cathedral in Lagos. So the first service that they opened, I attended, and I sort of did a story there. This was something that was like, I found it was quite like personal to me in a way. My mom's side of the family, a very big family, are all Catholic, from Lagos. My mom grew up around the corner from this church. She attended a smaller church, but this was the kind of main one.
Do you want me to show that article, Emmanuel?
Yes, please. So that's the 6th link. And so it's kind of, firstly, so for them all, it was like, they felt like it was really warming to see that I was writing about a church that meant a lot to my family. I have great aunts, who are like Reverend mothers, who are kind of big people in the Catholic Church. So that was like a lot of points for my family on my side. But one of the reasons why I wanted to document the church is because in this area of Lagos, there are a lot of elderly people. It's a part of Lagos that is quite old, a lot of old, and a lot of families that have lived there for generations. One of the reasons why Catholicism is strong in this part of Lagos is because it's a part where, obviously, not sure if you know much about the history of religion in Nigeria, but Catholicism was brought because of slave trade between Nigeria and South America and Brazil. And so many actually of the families, I have family members on my mom's side who have kind of Brazilian names. And so there's a real kind of South American heritage in this part of Lagos, and the legacy of that is also Catholicism. But a lot of the elderly people in this part of Lagos are also quite lonely. You'll see that, and poverty in this part of Lagos is also quite pronounced. And so I knew that this church was sort of, for many of these people, a kind of space of community, and the pandemic had really hit that, they weren't really able to commune in the same way. And I could see that from living in the area, and also just from, knowing about the community and the history of the church and the role the church played in the community. So I talked about that, I attended, and really, tried to kind of bring that to the fore. And also the ways in which, place of worship and religious groups really play a lot of roles in society that, we don't often understand or appreciate, like whether or not you're religious. And so I've tried to kind of bring that to the fore too. I'll kind of skip on to some other kind of key things as well. So one of the big themes in the kind of coverage of coronavirus in Africa has been testing capability of African countries.
Emmanuel, is there
which has
an article you'd like me to show?
Yeah, there's a one that says it was under testing issues. So that will be, do you see it?
Yes,
yeah. So as you can see in this article, I kind of talked to experts who are sort of explaining why I'm, kind of expressing worries about the lack of testing in Africa, in many African countries, I'll say, in terms of showing, in terms of countries being able to actually understand the spread of the pandemic, the spread of the outbreak in their countries, But also touching on other issues, why was it that many African countries, and definitely many countries in West Africa, were struggling to have, to get the requisite number of test kits? And it spoke to a lot of issues. It spoke to, even then, an issue that's playing out now with vaccines, again, with larger countries being able to secure agents for test kits much more than poorer countries or less wealthy countries were able to. And the inequalities with that, and the fact that this massive health issue, really this kind of medical emergency, was being governed predominantly by the market, by market forces. So unless countries were able to buy in bulk supply that could match countries like the US or China, smaller countries were finding that they were not able to have they were not able to get what they needed out of the market. So there was fierce global competition, and I felt like that was some of the key statements in what experts were saying that I was trying to kind of make sure was prominent in our reporting. There was also another side of it too, which is that, on the one side, global competition was having a big factor, but on another side, a country like Nigeria, biggest economy in Africa, wasn't able to produce its own test kits. Even though we have a history of disease outbreaks. So I guess there was two sides of that reporting, and reporting that I haven't listed here, but we were doing a lot of blogs, and the Guardian still has a coronavirus live blog, so it was something that I was kind of pushing a lot in blogs too. And maybe like the kind of last big issue I'll touch on in terms of COVID reporting which is linked to that, which was actually understanding how many people had the virus. Now, obviously around the world, almost every country is total is an underestimate, really. Like in the UK, definitely, we've seen that statistics. We've seen this through really good media reporting that the government statistics on who has the virus is definitely understating how far the virus has spread. We've seen that through things like deaths in care homes, which were not included, and through excess deaths. And excess deaths has been a kind of universal measure. But in Nigeria, you can't really calculate excess deaths because death calculations are not the best anyway. So it was already a challenge in terms of, like, we know that cases are lower in Nigeria and lower in many African countries than perhaps in the West and Asia, but how do we know exactly? How can we get a kind of stronger grasp of it? Then there was a case in Kano, which is Nigeria's third biggest city, the biggest city in northern Nigeria.
Is there a story that accompanies this, Emmanuel? Can you let me know if there are articles I should be showing as you go along?
Yeah, sorry. So it's the next one after testing issues.
Okay.
Cases spiraling in Kano, and then so what there were suddenly these reports of hundreds of people dying in a short space of time, within weeks, in Kano. And doctors were basically saying that because they had no test kits, they weren't able to know whether they were COVID or not. But what they were seeing was a large number of people dying from respiratory-related illnesses. And so doctors were essentially saying, we don't know if it's COVID, but it looks like it really could be. Because what ended up happening in Kano was really just a confluence of terrible factors. Firstly, the PPE was already an issue in Kano before COVID hit, and when the pandemic hit Nigeria, the government was really crap at getting PPE stocks ramped up. So medical services were already kind of worried about being open when an outbreak was spreading. Then when they started to see all these illnesses, emergency services started shutting down because doctors and nurses didn't feel like they could be protected treating all these respiratory illnesses that could in fact be COVID. So people who had other illnesses started also suffering because they couldn't access medical services in the same way. Jeslyn, you can click the next link, which is a feature I did, a deeper feature into the same situation. But essentially what I ended up doing was talking to grave diggers. I worked with a reporter in Kano, and we coordinated. He was on the ground in Kano, I was in Lagos. He went to 3 graves in the city, and all the grave diggers said the same thing. That essentially, they went from things being at roughly normal levels to them not having any space at all, and them having several people brought in every week, every day. And so the grave diggers and the accounts from the grave diggers ended up being a really insightful window into what was happening in terms of COVID in Kanu. Actually, something I didn't mention was at this time, the state governor was actually saying that there was no sign of COVID in Kanu at all, and that there had been no case of COVID in Kanu, even though there wasn't a single test center in the state that could even test for whether people had COVID or not. So you had like government officials denying that there was anything happening at all, and grave diggers saying what they were seeing was something that they'd never seen before. And that was a kind of good example of the way in which on-the-ground reporting could make up for really a lack of data, reliable data. And then something that's maybe happened more recently. So if you could skip to the next link, Jeslyn, there was
what was it like to interview a grave digger?
Yeah, it was the first time I'd ever spoken on the phone. I spoke to 2 grave diggers, and my colleague, most of us spoke to the others. I spoke to an elderly man, I can't remember his name, and it was just really, it sounded extremely unfortunate. Firstly, he had been grave digging for several years, and it was also interesting to talk to him about other things that weren't even necessarily related to the story. But it was, one thing that definitely it was striking, the things he'd kind of seen and dealt with in a context like Nigeria, where many people die in circumstances that come from injustice, right? And he's often someone who is a bystander to that injustice, but so he really had a kind of reservoir of stories and situations that I found really shocking. And obviously we were able to draw on his what he'd witnessed in terms of the pandemic in Khan. Also, expressing the fears of grave diggers too, because they're seeing all these people die from what people feel is a mystery illness at this stage. They were afraid and they weren't protected either. So it was a really, really kind of sad situation. Within a few months, what ended up happening was the federal government in Nigeria took over from the state government, basically said, took over kind of the lead in terms of dealing with COVID. And within a kind of within a 6 weeks to 2 month period, we're able to kind of set up several test centers in Kanu, kind of get a grip on the situation. Medical services were able to open again because they got PPE, and doctors and nurses felt safe to treat patients. And things got much better. And we blogged about that on The Guardian a few times. And it was an intention of mine to do a report on how Kanu actually turned it around before dramatic incidences happened in Nigeria with police brutality protests, which kind of just took over everything I was doing at that stage. The next story, and then the story I was saying, the next one in the link, Jeslyn, on that says on Nigeria more generally.
Okay.
Recently, Nigeria's health institute, or the kind of institute, Center for Disease Control, and also a government medical institute, did a survey that found basically about a quarter of people, 1 in 5 people in Lagos had COVID at one stage. Actually, at a stage when the numbers were saying barely anyone had COVID in Lagos. So this was a way in which, again, linked to some of the things we've touched on before, a lack of testing meant that actually officials in Nigeria were not able to see how far the pandemic was spreading. A lack of data on deaths and other things were meant when we weren't actually able to have reliable data. Anecdotally, people could say that it didn't seem as though it was as overwhelming as what was happening in other parts of the world, but really data was not reliable and available. And surveys like this has been some of the ways in which authorities have started to kind of try to get a more accurate window into what happened. retrospectively. Yeah. And then if you scroll down, just the last reporting by me that I'll mention is the one as the profile of frontline workers. This was, so I spoke to, that's Juliet Nurse Anyanwu, and spoke to 3 other Nigerian kind of frontline. And we did it as part of this piece in The Guardian, basically just trying to, show just the kind of incredible effort that these people have had to undertake in the last year, and show the kind of mental toll that they've kind of gone through as well. So it was super, to be honest, just kind of left these conversations feeling like, just admiring these individuals and what it's been like kind of being in the thick of it in Nigeria. So it was kind of really great to, I worked on that piece with a few colleagues to kind of contribute to that. And the nurse who ended up being the kind of cover of the piece was lovely. I spoke to her a lot, and actually about a week after that, my girlfriend and her family all got COVID, including her dad, who ended up being admitted in the hospital where this nurse worked. And she ended up being super helpful and just kind of like reassuring us while we were losing it, because my girlfriend's dad had severe conditions, and he'd lost like 10 kg of weight and needed oxygen. So it was really in a hole. So at the time when we did this report, I really kind of bonded with some of the people I spoke to, but I didn't realize how much more we were going to end up speaking, and essentially like how much I'd need them after interviewing them. And that was even an even deeper window into what was going on in these centers, because I was kind of able to see, I was basically staying at the center, overseeing the situation with my girlfriend's dad, and seeing how health workers were overwhelmed with cases, and how the juxtaposition between that and a situation in Nigeria where still you'll meet a lot of people who just feel like COVID is an elite conspiracy to kind of get international aid money, because there's such distrust in government that people really just are very skeptical. And the last thing I included, Jeslyn, the last 2 links was coverage that I'd seen elsewhere that I really kind of rated or was thought was really good. So not my pieces. The first one was it's Payward. I just realized, yeah. But Financial Times, essentially, it's a feature by their Africa correspondent called David Pilling, which looks into the steps that African countries took to kind of make sure that the pandemic didn't spread as rapidly as it did in other parts of the world. And it was a really comprehensive look, speaking to government officials, medical officials across the continent. And I think probably is the best account I've read at what African countries were able to do right. And really touched on things that definitely I'd included in reporting too, which is that especially West Africa, where West African countries have, unfortunately, a lot of experience with dealing with disease outbreaks, from Ebola to yellow fever to Lassa fever, and others. And so the systems that were in place from those disease outbreaks really kind of kicked into overdrive when COVID happened. And so at a time where actually a lot of reporting on Africa was like really kind of bleak and kind of apocalyptic, it was already kind of clear to me, talking to a lot of medical professionals, that they felt much more confident than maybe some of the media reporting was making the situation out to be. And then the second piece in that was fighting COVID in Nigeria amid disbelief of the virus, which is a video piece by the BBC by a friend of mine called Yemisi Adegoke, who's a reporter at the BBC, who went to the main COVID treatment center in Lagos and essentially did a video piece on what they were dealing with. And that was like a really kind of, and again, juxtapose that with disbelief outside these centers where people kind of were wondering whether COVID even existed. So this is also a really good piece, a really good piece of reporting into the situation in Lagos at the time.
Emmanuel, can you see can you see the articles as I'm putting them on the screen?
Yeah, I can now.
Okay, yeah. Would you mind if we pause and watch this BBC video?
Yeah, absolutely. Please do.
Okay, and is this in Nigeria?
Yes, this is in Lagos. So the
your
center
colleague,
is the,
okay, your colleague did this.
yeah.
Okay,
Yes,
great.
exactly.
All right, let's go ahead and we'll go ahead and watch this.
Cases of coronavirus are rising on the continent. We've been given exclusive access to a coronavirus response team in Africa's most populous city, Lagos.
This is one of our severe ones that we're paying very, very close attention to.
I thought it was all over. The streets outside this hospital, some people don't believe this pandemic is real.
Coronavirus is abroad, not here. They're lying because I've never seen someone that had the coronavirus in this Nigeria.
It would have been funny because if it wasn't so devastating.
Lagos, a bustling and vibrant state that 20 million people call home. It's now the epicenter of Nigeria's coronavirus battle. After a month-long curfew, restrictions are now being eased, but the virus shows no signs of slowing down. These are the doctors and nurses on the front lines. Dr. Lemke is the team lead. He's worked in infectious disease for many years, treating illnesses endemic in the region like meningitis. But he says nothing compares to this.
I don't think anybody alive has ever seen anything like this.
We're now on an isolation unit at the Lagos University Teaching Hospital. Anyone who tests positive for coronavirus is treated here.
The patients on this ward vary in age. Some are in their 20s, others middle-aged, a handful are elderly. While some are gradually overcoming the worst symptoms of the virus, others still need oxygen to help them breathe.
How are you doing today, sir? Okay, yeah. Let me check your oxygen levels.
This man is 75, and like many hit hardest by the virus, he has pre-existing health conditions. He was at the hospital for a routine procedure when he collapsed. It turned out to be COVID.
If you see it for a while,
At least he's conscious now, he can talk about it, but he's one of our severe ones that we're paying very, very close attention to.
Successive governments have been accused of underfunding healthcare here, and strikes are common. Last month, resident doctors protested the lack of protective equipment, hazard pay, and poor welfare conditions. Medical staff are working long hours. Nigeria's hot and humid climate making the wearing of PPE particularly uncomfortable and exhausting. Staff are so busy they sleep in accommodation on hospital grounds, unable to see their families for weeks on end.
Always, thinking, rolling back, thinking, okay, if we had this, or if we had done this differently, or if this person, if he had come earlier, but there's a sense also of anger. Why didn't he come earlier? Why did he come so late?
One reason why people aren't going for testing or treatment in time is because there is a belief that the virus isn't real, or that the scale is being exaggerated. Such rumors gained traction after this video was widely shared online.
this is the isolation center of
It claims to show an abandoned isolation center with no patients. The government denounced the video, saying it was misleading, but many Nigerians are still skeptical.
People are dancing, eating, there's no corona. I said it on YouTube now. You don't see anything like coronavirus. Nigerians are eating, it's real. But we have not seen anybody who will show you that coronavirus is real. You know that our government, they are lying for us. Especially Lagos state government, they are lying for us. All this I went there, I see the people, people there, they know English, that's what they told them. It's not real. They are using it to fraud the masses that are already suffering. If corona is in Africa, this vicinity, about 30 people supposed to die to make me complete.
There's a historical mistrust between some Nigerians and the government, meaning in addition to the belief the virus isn't real, many people aren't adhering to government advice on safety protocols.
No one that we spoke to was wearing a face covering or a mask or was adhering to social distancing. These things are mandatory by the Lagos state government. And as the numbers continue to increase, things like this are a big concern.
Much of the country's economy is informal. Lockdown measures were devastating for the millions of families relying on a daily wage. Nigerians are eager for things to return to normal, but not following safety advice makes it more and more difficult for medical personnel like Dr. Akase, for whom the pandemic is a daily reality.
It's not just among street people, ignorant people. We have seen this among educated people who are well traveled. So it's an unfortunate sentiment, which I don't know if it is a global thing, but for us it's a real problem. And I think this will complicate efforts to curb this in our country to a large. Sorry, lift it.
Despite the disbelief outside, the suffering inside the wards is very real.
Just I thought it was all over. I'm quite to have it.
This woman has lost her sister to complications stemming from COVID, and now both she and her nephews have been admitted with the virus. She's currently on oxygen, distressed because she's unable to bury her sister.
My sister, my brother sister, she's gone. I'm not buried her yet. Look at me with the phones. We are here. Admitted. I don't know why they sold for me.
Patients spend weeks on the ward with the medical personnel and each other as their only company. Many staff carry the weight of what they see with them.
So when you're going home, you're thinking, okay, so this, should we have done this? Of course, then there are those that died, so you get to carry that with you. Yeah.
Until now, Africa has been behind the curve, but that's changing, and countries here are bracing themselves for when this pandemic reaches its peak.
Yeah, so that was a really kind of strong visual window into what was some of the things I'd mentioned. You could see some of the people who were interviewed, how animated they were and convinced they were that it was a government conspiracy. You know, when Ebola in 2014, when the Ebola outbreak happened, it penetrated, you know, what the government was saying really kind of had a hold, because people could see that this disease had really kind of clear visual effects and people died. You know, it was a fatal disease. And so a lot of the measures that the government were pushing for people to adopt, it was very easy to get them to adopt these measures. You know, there was high alert at the time. You know, as with everything in Nigeria, everything becomes banter. People would kind of greet you and just look like, "Oh, you ain't got Ebola." Like it was a whole thing. With COVID, it's completely different. You know, people wear masks because state police can stop you and harass you if you're not. So they kind of have it under their chin. But if that, do you know what I mean? Like in reality, people are kind of looking at you if you are taking it seriously, like you're a bit like you bought the propaganda, haven't you? You don't know much better. And so these are the kind of conditions. And really it's not, I think maybe one of the things that we could have done more is to show how government a lack of trust in government and in governance in Nigeria, and corruption and all these kind of systemic failures meant that when you have a public health crisis where you need buy-in, where you need people to trust what authorities are saying, these things weren't there, and these things essentially have led to lives being lost, because we don't have a context where people trust the government to take the pandemic seriously enough. And maybe just like the last observations I'll make is it was about covering COVID for me personally in Nigeria and West Africa has been two things, I'll say. One is there was a point in the pandemic where it became clear that we weren't. Well, I was essentially looking for positive stories about what governments were doing and to kind of show innovation. And some of those stories we weren't able to do for logistical reasons. There were some things that I found that I thought were really, really profound, but they were in parts of West Africa that, firstly, that it took a while to get sources there. Then when we could, insecurity complicated getting reporting that I could really verify. So there were some things happening in parts of Burkina Faso that I thought were really interesting, but took like a month just getting to a stage where I could trust what and verify what I was hearing. And by that time, things had moved on, and so sadly, I wasn't able to document it in the way I wanted to. There were other things too. There was in Senegal.
What was the issue in Burkina Faso? What was the story you were chasing in Burkina Faso?
I don't want to talk too much about it in case I do end up going back to it, but essentially, because Burkina Faso, but broadly, because Burkina Faso has been struggling with violence, jihadist violence in much of the country, but recorded cases in parts of the country close to where the violence is was still low, and testing actually in those parts they were able to kind of maintain relative to what the country was able to do in its capital, decent levels of testing in some rural parts of the country. And the ways they were able to do that I thought was really interesting. And so I was trying to build a kind of detailed picture on how a country struggling with a lot of insecurity was able to kind of manage the pandemic when really that wasn't its main priority at that stage. So things like that. In Senegal, the Institut Pasteur, which is this prestigious medical institute, created a COVID test that got some reporting in some parts of the media. But when I tried to check that up, I realized that some of the reports made it seem like the test was imminent, or like the test was about to be this kind of $1 test. But till now it hasn't been. My understanding is they've not been able to kind of get it out en masse. And so some reporting, I think, was eager to respond. I think there was a lot of bleak reporting about Africa, and then there was a kind of response to the bleak reporting, which is kind of like, we're going to show the innovations and the great things happening. And sometimes both things can be wrong, not all the time, but sometimes, I was seeing some stories that I couldn't stack. It didn't stack up to me. And sometimes also there were points when, there was a similar incident in Nigeria where another prestigious medical institute had produced a COVID test that I was very close to reporting on, as saying was, because they were talking to the WHO, and the WHO, they said, were about to approve it, and it was about to roll out, and it was going to change the testing landscape in Nigeria. And that was in November. We're in March, and test still hasn't gone out. And so sometimes I've had to kind of be careful, firstly, to try to resist sometimes impulses, because editors also are responding to what's being published elsewhere, to kind of drag our coverage can sometimes kind of be clouded by that, to make sure that our coverage is not like painting, or my coverage is not painting this super bleak picture of what's happening in West Africa or Nigeria, to kind of show the nuances of it. That, like Nigeria is struggling with COVID, absolutely, but also that, the government has ramped up the number of laboratories. They had like 4 that could test for COVID at the early stage of the pandemic. Now they're about 150, I believe, or close to that. All the different ways in which Nigeria has ramped up and done well, but also, again, the myriad ways in which, to be frank, they have struggled, or there have been inadequacies. So trying to show the nuance, either from not allowing reporting to become too bleak, but also not falling into the opposite temptation of sensationalizing innovations that maybe have not yet come to fruition. So that's one observation. The second observation I think I have, looking back at COVID reporting, is that I I definitely realized that I wish I could have done more reporting, if looking back, that looked into the kind of things like, for example, sexual abuse cases in Lagos during the pandemic, during the lockdown. You know, this was something I was talking to an NGO about, because many people who were dealing, many victims of domestic abuse were struggling to alert authorities. I mean, they struggled to anyway, and it was becoming a more acute issue. But there are so few organizations that work specifically on this, and they are often on demand, and they are often careful about what they put out in statements, sometimes even when they know it's broadly true, that it was hard to get strong reporting on that issue. There was one point where I was close to filing a report, and one of the key people who was a source for it pulled out, because she was nervous about it and the implications for her, because they worked closely with the police, and she didn't want the police to feel that she was pointing out ways in which they were inadequate. So sometimes I had like maybe about one or two instances where organizations close to law enforcement that were, essentially, they were telling me that law enforcement failings were leading to victims suffering more during the lockdown, but were reluctant to say on the record what was happening because they have to work with law enforcement. So there was some tricky stuff like that, and I think if I had been in Lagos at the time, I would have maybe pulled through to find a way to show the impact of that, because I think that's something that till now has like been underreported in the experience of Nigeria in the pandemic. Yeah, so those are kind of like I've touched on a lot of different things, none in super amount of depth, but hope I've given like a broad observation, a broad outline or outlook about what covering COVID has been like for me, both personally as a journalist, and also how the reporting has been, some of the challenges I faced, some of those challenges we were able to overcome, like trying to build a better picture of what was happening in Kanu. And some of those challenges we weren't able to overcome, like some of the instances of reporting I wish I was able to pull through and do, but couldn't. Yeah, but all in all, obviously, coronavirus reporting is still ongoing, and vaccines is another kind of key part. The international correspondent has mainly been leading on that, but I know that's something that I'm going to take on more in the next few weeks, as many of us have seen that vaccine inequality is like a big issue, which the Guardian kind of covered quite well, but something I'm sure is will lead to more specific reporting soon. And yeah, that's kind of broadly fair to say, and I hope it's been that kind of insightful. And I guess I'll take some questions if that's what we're doing.
Awesome.
Jeslyn.
Really good presentation. Thank you, Emmanuel. So, guys, if you'd like to do it this way, Emmanuel, are you on a computer or a phone? Emmanuel, are you on a computer or phone?
Computer.
Okay, good. Well, let's why don't you guys go ahead and type some questions in the chat, or just ask your question out loud, and then I will help facilitate that. So who has a question for our speaker?
So my cursor is doing this kind of spinning thing where it's like endlessly loaded, so I can't click on it even though I can see everything happening. So maybe if someone types a question, maybe you could WhatsApp it to me, Jeslyn, or you could say it to me.
I will just say it out loud. Could someone give me a question, please, right now? Could someone come off mute and ask a question?
I just sent this in the chat, but when did you draw the line between getting a story and protecting your own health?
Did you hear that,
Right. Yeah. Sorry, I didn't get your name, but I think you said, where did I draw the line between reporting on a story and protecting myself during the story? Yeah, that was definitely a challenge. Like sometimes, to be honest, I was probably in a bit of a compromised position. I've reported where like I'm interviewing someone. We start off wearing a mask. We're comfortable in the interview, that we built familiarity and they're opening up to me, but then they kind of open up and take their mask off, sort of thing, or then they like just kind of like sort of, yeah, the conditions that were meant to be safe, yeah, they kind of like undermine that a bit. And then sometimes in those instances, I'm just thinking about, yeah, sometimes I've definitely said, oh, please, if you could wear a mask. Other times, maybe I've not said that. There's definitely been times where and even till now, I've done reporting where not even necessarily on COVID. I think this is definitely a big challenge of journalism. Now, last week I was in Senegal, reporting from towns and villages along the coast in fishing communities mainly, where I thought people weren't taking COVID that seriously in Nigeria, and Senegal was just like really eye-opening. um, you know, again, real distrust in government, real skepticism about COVID. In a lot of the places I was going to, no one was wearing masks. I went into people's homes to talk to people who had gone through experiences I wanted to hear about. And initially some of them would wear masks, but then, there was one day where people were grieving, and they were crying, they take their masks off, they start talking. We're in a room where there's basically no ventilation, like and I'm talking to about 12 people, half of which are wearing masks to begin with. And by the end of it, maybe like one person is. Do you know what I mean? Like in that situation, it was just kind of like, yeah. At the end of the trip, during the trip, I was joking with like, a reporter I was working with, that if we don't get COVID from this trip, then I'm not sure when we will, sort of thing. Because I'm double masking. I'm like, but ultimately I'm surrounded by people who firstly don't really believe coronavirus is a thing, and they kind of half-heartedly kind of follow the measures. So yeah, like I guess the simple answer to your question is sometimes I don't draw the line where I should. Sometimes I kind of prioritize the reporting but I try to make sure that I'm being as safe as I can be in the circumstances. Yeah.
Okay, thank you. And then can you read the chat on here, Emmanuel?
No, the cursor is still being slow.
Okay, yeah.
But
okay, someone wanted to know, and I'm going to shorten this question. How do you maintain a balance between ethics in journalism about exposing things, but not damaging your relationship with a source, as in the example of the domestic violence story you wanted to cover? So how do you maintain that balance?
Say that again, between the ethics or?
How you've developed your sense of ethics about exposing things, but also not damaging your relationship with sources that need to stay protected, like domestic violence survivors.
Okay. Right. Yeah, I think broadly, like my kind of like general principle is like you're protecting the person first. I'm not really the kind of journalist that's like gonna risk it all for the story. It's like ultimately these are people's lives, and uh, and so like actually broadly it tends to be quite easy. If I feel like it's a story that could literally have like deep ramifications for someone, and they are saying, so I guess maybe that's in reference to the woman who I spoke to, who was talking about some police failings, but she then kind of reneged on being quoted in it, sort of thing, and just said I withdraw everything I said essentially. So I wasn't even able to kind of say like anonymous. She didn't want anything, and because there were so few organizations working on this in Lagos, they felt like even anonymous, saying that they were anonymous was offering no real kind of protection. Now, like in that instance, to me, it was just kind of clear cut that, I know the space that these people work in, and they do super important work. So I wasn't going to do anything to jeopardize that. I wanted to report on the story, and I think my approach was, well, I needed to find another way of doing it. But if I couldn't find another way, then I wasn't going to do it in a way that was going to kind of put them at risk. So I think in those, sometimes this happens. This happens a lot. This has happened to me a lot, where someone is talking about something that because the environment in Nigeria, it's not the most liberal environment. You can be arrested, you can be detained at will, you can be sacked. Anything can happen if you are a source for a story that someone powerful doesn't believe is favorable to them. So yeah, ultimately I think I try to be as kind of considerate about the people involved in the story, and do my best to find out how to report on important things in a way that doesn't compromise people's safety.
Okay. So one of the students was impressed by trying that you wanted to focus more on optimism, like more optimistic story coverage. What kind of change do you feel can come from reporting more optimistic stories like this during the pandemic?
Yeah, the only bit I missed was you said one of them was impressed by something.
Yeah, so the students were impressed that you were writing stories that were more optimistic, and they wanted to know, how can writing stories that are more optimistic bring change during the pandemic?
Right. Yeah, like the first story I wrote about the volunteers. Now, obviously, that could have been written in a different way. It could have been like government failure and many people kind of left alone. Do you know what I mean? With like no food and stuff. The groups that were doing a lot were only doing so much. Do you know what I mean? Like ultimately, the state had the ability to do more, but didn't have the will to, and perhaps didn't. They said they didn't have the means to do more than they did. Um, I think that I chose to approach it that way because if I kind of just reasoned, I guess, that like the groups that were doing that is such a kind of boost to them when you're doing something in a place like, and people don't do things for praise, but when you do, when your work gets recognized, it's such an encouragement, you know. And I remember I could see in talking to the people who I was interviewing for the story, it meant a lot to be, for the work that they were doing to kind of reach a wider audience, and I think that had an impact because they then were, it's a spur in it. It's a kind of it's just an encouragement, as well as me documenting what is happening. I think that is important because, the news can be really bleak. Do you know what I mean?
Yeah.
And it's a challenge to show the ways in which, even in bleak situations, people, amazing people do amazing things, and people, to me it was almost ridiculous. Like it's just like a couple and then a couple of friends who just want to help people in their community. They end up having such a detailed database of different degrees and types of need in a community, kind of information really that a really efficient local government would have about people in their in their community if they wanted to help, and the kind of information that I felt could be leveraged to provide real welfare. Do you know what I mean? Like real targeted welfare, because the support that they were given was not arbitrary at all. It was extremely targeted. They knew who needed gas and how much. They knew who needed what types of food. Aid can be really kind of generic. You kind of give poor people rice, or you give them this or maize or whatever. Families may not like rice. You know what I mean? And so like or whatever else. They knew what types of food each family needed and bought regularly. They knew the kind of health issues they faced. They knew who had diabetes and didn't. You know, like it was insane to me that what began as just trying to kind of help in some small way became a very detailed, efficient kind of, and yet really organic form of providing support to people who were just kind of strangers in their community. And so I kind of felt like when you see kind of initiatives like that, it's amazing and it's easy to kind of give it a platform, and it's just a spur to other people doing similar things, and it's great to kind of find stories like that.
Uh-huh.
Yeah.
Here's another question. How do you manage the stress of being a journalist, especially during COVID?
How do I manage the stress? Oh, is that it? Okay. um. Oh man, I don't know how I manage the stress. I guess like Sorry, I didn't miss the question, right? Is it just how do I manage the stress of being a journalist?
She just wanted to know, how do you manage how do you
Yeah.
cope with the strain of the pandemic, but also trying to be a reporter? How do you manage that stress?
Okay, yeah, like I guess it's a hard question to answer. Sometimes I have really terrible days and it's hard, and I do what like we all do about like anything we're doing that we find stressful. If you talk about it to like your loved ones, you like rant, you rant, you vent. Do you know what I mean? You like, and then you kind of keep it moving and go on, because like I guess like your kind of guiding thing is like why you're doing what you're doing. I guess like journalism for me was extremely hard to get into. I faced like a lot of challenges. I didn't know anyone in journalism. Um, uh, Journalism, I think, in many parts of the world is very kind of it's a access, especially if you're from minority groups, is very difficult. If you're not from a privileged background, can be very difficult. I, didn't finish my degree. I left in my second year, and was freelancing and writing, and so I found it very hard. And so when I kind of got to where I wanted to get to, I felt and I still feel extremely grateful. And I think for me, what kind of keeps me going is like knowing what like I really kind of want to do, which is like, yeah, I love to kind of meet people and write about things I didn't really understand before, and I didn't come to understand it through conversations with people. Journalism is also just such an amazing excuse to speak to strangers and to get them to tell you stuff that really you have no reason, you have no business in their business. Like they're actually doing stuff. You're just kind of wasting their time learning about it. And then you get to write about it, and it's fantastic to me. And so it's like a pleasure. And yeah, like you always go through challenges and hard stuff, but like ultimately, it's like it's an immense pleasure, and you're in a privileged position, and also you're in a position of power, because like you are framing the way someone is going to see an issue, and people are
So Emmanuel, I think we have one time for one more question.
Oh, okay, sorry. Yeah, sure.
Okay, can you hear me? So one of the students asked, I always felt the US was way behind in COVID action, but this has been eye-opening to see how it is viewed elsewhere. Do you feel that the skepticism of COVID's existence is harsher in places like Nigeria and Senegal, or would it be more harsh in the US? But I guess I'm not sure what it's like in the US. But
yeah, I followed reporting, but could you just repeat the question again? Sorry.
Ren, do you want to repeat your question out loud?
Sure. Yeah, I was just wondering, I'm like Jeslyn said, I'm not sure how much, like you said, you follow the US a bit, but do you feel like the view of COVID as like a hoax or as not existing is more prominent in like Nigeria and Senegal, or is it worse in the US?
Right. Yeah, I would say like that's an interesting question. I don't know about the US situation as much as you would, obviously. My sense of it from news is that it's quite a significant thing, that there's a significant minority of people who think COVID is a hoax in the US. Um, uh, and I would probably say there is maybe a slightly more of a significant minority in parts of West Africa. I don't want to overgeneralize, depending on the country. I would say in Nigeria, there's definitely a significant minority who feel the same. However, some of the motivations and the kind of underlying ideological kind of tracks beneath believing it's a hoax are different in the US as they are in a place like Nigeria. I think I saw that one of the kind of the lowest group that on in terms of uptake of vaccines in the US were far right white nationalists in the US. And so there's definitely a kind of like something ideologically going on there too. In Nigeria, I would say there are different issues at play. It's not an ideology like that, but definitely distrust of the government, which would be present in groups like that. And also like other factors, like actually there is a legacy of, big corporations doing very dodgy things with testing people in Nigeria. There's the Pfizer scandal that you can look up after this, that I don't have time to get into, in Kanu actually, where they had to pay millions of dollars in settlements because they tested people without their consent. So yeah, there are different reasons, factors at play. But yeah, I would say it's a big issue. Yeah, but maybe not for the same reason.
Yeah, it's really interesting to see the differences.
Yeah.
Okay.
Yeah.
Emmanuel, thank you so much for your time.
Yeah.
Chandler and Bren, thank you for sticking it out. I'm gonna stay on with Emmanuel for a few minutes afterward, but you guys are free to go, and let's give him a hand. Thank you.
Yeah, no problem. Thank you. Thank you.
Thank you so much.
Thank you.
No, it's no problem. Thank you. It's a pleasure.
Okay.
All right.
Yeah, sorry, a lot of people had to run to go to their next class.
It's okay. It's okay. It's no problem.
Yeah, but we had some good attendance.
Yeah. How was it? I hope it was fine. I hope it went
well. Yeah,
well.
you did a really good job. I'm gonna stop my recording.